So thank you, Per, for the introduction, and I'm very happy to hear that there is a lot of interest in the app that we have developed so far, and I will go into more detail about the digital future of these tools in respiratory care. So maybe first a short introduction on what is eHealth, what is Mhealth. So eHealth covers actually all online and offline support based on any IT solution. So we have electronic health reports. So that was actually the first step towards digitalization of the healthcare. We have telemedicine, which is especially important for remote places. So people who have not easy access to medicine. So we have the internet, which can be particularly interesting to provide patients with educational material in an online way. We have electronic pharmacy prescriptions. On the other hand, we have Mhealth, which covers both apps and wearable devices, of which we know best the physical activity trackers that you can wear on your wrist. So we think that there is an added value of these tools for all the different stakeholders. Also for the patients in tracking their symptoms, getting personalized feedback, being able to share these data with their healthcare provider, but also getting reliable educational content on the disease and the treatment options. Also for the physicians, we have early identification of uncontrolled disease and a standardized follow-up of the symptoms. For the research, we have a generation of real-life data, which will be very interesting to evaluate outcomes after initiating medical or surgical treatment. But also for the healthcare system, in time we hope to be able to show that implementing these tools might be a cost saving for the healthcare system. And then lastly, also for society, it might, by implementing these tools, reduce absenteeism, presenteeism, reduce economic costs, and eventually also be preventive for disease progression. So we did a mapping of all the Mhealth tools available in 2 app stores, Android and Apple, to see what is really there for asthma, COPD, rhinitis, rhinosinusitis. You see that most of the apps cover the lower airways, whereas only few apps are currently available for the upper airway diseases. This is more detailed information. You see, for example, that very few of these apps are developed by medical experts, a lot by medtech and app developers. Only half are updated in the last year. Good to see that most of the apps are available for free for the patient, because we also think that this is a way forward. When we look then to the different functionalities of the apps, be it patient self-monitoring, patient feedback, patient education, we see, for example, that almost half have functionality to monitor symptoms or disease control, whereas the objective parameters are less implemented in these apps. When we look to the patient feedback, also up to half have possibilities to show the results or share the results with the healthcare professional. And with regard to education, we have mostly information on treatment and disease. So in order to, I will go in more detail into the different parameters that can be measured by use of these Mhealth tools. And these are patient-reported outcome measures. These are physiological parameters, biological parameters, adherence to therapy, and environmental exposure. Most of the apps mostly focus now on this, but I think a full monitoring in future might be possible. And we showed this already to you, that we have this system now to monitor these symptoms via a very easy VAS score. There is a possibility to register the medication use. The patients get a weekly reminder, and there is patient feedback, which is very much appreciated by them. This is a system by which they can share the results with their healthcare provider. They have a QR code on the screen of the doctor. They can scan it, and then the data are visualized in this way, and then you can appreciate the evolution of the symptoms and of the medication use. Also, a similar app has been developed for allergic rhinitis, which you might have heard about that. Then we go to some objective parameters that might be implemented into the Mhealth tools. We have physiological parameters. For asthma and COPD, this is mainly lung function. Daily peak flow measurements have shown to be effective in reducing the burden of uncontrolled disease, and there are now some devices, wireless devices available which can connect with Mhealth tools and import this information also and link that with the symptoms. For upper airway diseases, it is less clear which objective parameters we can use. For example, to evaluate nasal patency, you can think of peak nasal flow measurements, but yeah, you might obtain very variable results from the patients. And then we have also general health-related parameters collected by wireless tracking devices like pulse rate or physical activity, which might be interesting for the lower airway disease, or impact on sleep quality, which is especially interesting for CRS. So now that we are moving towards endotype-driven treatment, there should also be possibilities to integrate this type of information into Mhealth devices. And this is a nice example of that. For example, for the FeNO measurement, you have the NIOX equipment, which can be used and linked with Mhealth devices. For example, here the My Air Coach for asthma. And then also link this measurement of degree of inflammation with symptoms. In order to move this, there is really a need for point-of-care solutions which are which are cheap, which are easy, which are simple, and can be used in daily practice, and then integrated into the Mhealth tools. Another thing is the adherence to treatment. So there are several options also there. We can have reminders for taking the medication, for example, to increase the adherence. We can have a patient-reported medication use via the Mhealth tools, like we have in My Sinusitis Coach. But you can also go one step further in tracking the adherence by use of the smart sensors, and several products are now being tested for inhalers, and I think a similar approach can be used for nasal sprays or oral medication. And also here, this is something that I found for the feedback to the patient about their adherence. Here you see that we had a 75 adherence this week. They used it 10 times, whereas 4 times they forgot to take the medication. And this might also increase the awareness about that. Then collection of individual exposure to environmental stimuli. So this is possible via geolocalization. So the patients need to give specific consent to track the location at time they complete the symptoms. And then we are able, via mathematical models, to estimate the individual exposure, for example, of outdoor air pollution, of pollen cones. And in this way, in future, if we have a lot of data, we might be able to give alerts to patients to, for example, modify their activity, have personal protection measures, or even to change medication and be preventive for future exacerbation or deterioration. And in addition to the monitoring, we also have patient educational material in our app, which you saw already before, based on a a list of frequently asked questions and some easy answers for the patients. And these are some of my last slides in which I want to show that by implementing this full monitoring of the patients, we are able to also deploy the principles of precision medicine into daily practice. For example, with this tailored patient feedback on the level of disease control, we can have action plans, so really detailed information on how to do self-management. It has been already shown for asthma that this can work, and I hope we can also implement this now into upper airway disease. Also for prediction of disease progression or outcomes after medical and surgical treatments, I think there are a lot of options with Mhealth tools. We might achieve prevention by increased patient awareness, overall improved disease control, and as I mentioned, by monitoring these environmental triggers, if we use big data, we can then hopefully also predict and take measures to prevent deterioration. And then lastly, also patient participation by educating the patients about their disease and make them self-manage their disease. And I want to end with this slide, which is a summary of our brainstorming session at our research forum of November in Brussels, where we highlighted or identified several challenges to move this field forward, which are big data analysis. So there's a lot of things going on to use this type of data and to turn this into new knowledge about the disease. We have this GDPR, so the new regulation on privacy protection, which is now going to be active from May of 2018. And yeah, apps really need to comply with that. Okay, so I was almost at the last slide, highlighting the challenges in Mhealth. I think I was at the comorbidity issue. So we have now different apps. We have an app for allergic rhinitis, rhinosinusitis, different initiatives with asthma and COPD, but I think in future we need to think about how we can integrate that and present to the patient one tool which might be able to monitor different aspects of their upper or lower airway disease. And then lastly, I want to tell you that we are indeed trying to define different tools to optimize this process of the care pathway, and we are currently doing a survey amongst the clinicians here at ERS, and I would warmly welcome you to complete this survey or come to me to ask for the link. And with that, I want to thank you for your attention. If you have more questions, please visit us at our booth or come for a flyer. Thank you.